Well, as we mentioned earlier in the show, the historic health care bill passed over the weekend.
But the political and legal battle over it may just be beginning. UW political scientist Charles Franklin is here with some expert commentary, as you always do. First of all, this was a big deal. This is pretty historic.
It really is, and in two ways. One, of course, this has been something that's been a Democratic agenda item since the 40s, at least, since Truman's time. The other is, for all of the difficulty of passing it, for all the resistance, all of the negotiation and everything, for the Democratic administration to stay with the bill and ultimately succeed is really a feather in their cap. Now, of course, Republicans will say it's the wrong thing to do, and they're gearing up to fight it in the future. But purely from a Democratic perspective, this was a success, and it was a president who staked much of his administration on this and stayed with it. In contrast, remember, George Bush tried to bring more privatization to Social Security and bet a lot of his political capital on it, was unable to pull that off, in large part because his party didn't remain united behind him. Here in this case, most of the Democrats, except for 34 that ultimately voted against, stayed with the president. And so I think it's a political success. We'll see whether it's a policy success.
Well, the country is very divided over it, and now come probably all of the legal challenges. So how soon before we would actually see any of these changes?
A few of them will go into effect immediately. Those are mostly about regulation, about insurance companies and how they deal with people who have insurance with them. But most of them don't kick in until 2013 or 2014. And they tend to be phased in. There are going to be some increases in Medicare taxes, payments for Medicare and your withholdings. And there are also going to be new regulations for things like mandatory coverage, that you'll have to buy coverage of some kind for yourself or pay a fine for it. And also the requirement that insurance companies cover people with pre-existing conditions. That doesn't kick in immediately. So I think one of the fears or dangers for Democrats is that these things are phased in over time. So I think voters are unlikely to see immediate benefits, except for a few of these regulatory issues that do kick in right away.
And a lot of the politicians are concerned about the midterm elections in November. November's a long way away from now. Do you think this is going to have an effect?
I think that Republicans are lining up now. You had in your last piece Representative Ryan talking about repealing the bill. But I think the issue is going to be, by November, it will have faded into the background with jobs likely remaining in the forefront. So we'll have to see how it plays out. I think just as Democrats assumed there was more support for covering everyone than there really has been, it may be that Republicans find there's less excitement about repealing a bill that's already gone through. We'll have to see how the politicians play that out.
Time will tell.
Yes.
You think we're done?
Well, we've still got to have the Senate decide what to do this week. I hope not to be back, but I might be back one more time on
All right, Charles.
Thank you, Charles.
Great to see you regardless.
Thank you.